Neuropsychology is a specialty within the field of clinical psychology. It primarily is a field that focuses on the function of the human brain. There are disorders and conditions that show up on MRIs and CTs that don't affect an individual's cognitive function, just like there are disorders that come through neuropsychological evaluations that don't show up on MRIs and CTs. It's a specific field that looks at how people's functioning in any area of their brain plays out in real life, what it looks like to other people. One of the main functions of a neuropsychologist is to perform neuropsychological testing. I receive referrals for neuropsychological testing from pediatricians, from neurologists, from rehabilitation centers, from physiatrists, which are doctors of physical rehab, from primary care physicians, and people are referred to me for a variety of reasons. The components of a neuropsychological evaluation include assessing intelligence, attention and concentration, language and speech, memory, processing speed and ability, ways of learning, the executive function, which includes planning, decision-making, time awareness, impulsivity, patience, emotional regulation, looking at visual, spatial, and motor abilities, sensory processing, modulation, and integration, and as well as personality and behavioral and emotional functioning. Sometimes when someone has a brain injury, it is important to determine what their baseline functioning is after they've had their brain injury. The brain injury could be anything from a stroke to an aneurysm, to having multiple seizures, cancer, a sleep disorder. Just a number of different kinds of conditions can cause brain dysfunction. And so my role as a neuropsychologist is to determine a person's strengths and weaknesses in order not only to get that baseline, but also to help plan for treatment, for cognitive rehabilitation and cognitive retraining. Many times people are referred to me for the evaluation of adult ADHD. Many parents of children who I have evaluated have determined that because it is a heritable condition that perhaps they might have it as well and were overlooked in their academic years. I not only assess for the ADHD, but I help these people develop plans to cope with ADHD, to develop accommodations and compensation techniques so that they may function better in their work, in their marriages, in their academics if they're pursuing additional education. I also receive referrals for pre-surgical evaluations. Many insurance companies require a neuropsychological or personality evaluation before an implant is positioned into their body, whether it be a pacemaker or a spinal cord stimulator for chronic pain patients, or perhaps they're undergoing a bariatric surgical procedure and their mental health needs to be addressed and recognized. Many chronic pain patients need to take medications that affects their concentration or their ability to sustain their mental energy towards their work-related tasks or even activities of daily living. And so some of the physicians refer their patients to me in order to determine the effects of their pain medications on their cognitive functioning and their ability to work. The results of my neuropsychological evaluations are often used to determine baselines after a brain injury, and then a year or two later to reevaluate someone, again with a neuropsychological evaluation, to determine treatment progress or the need for further therapies. As part of my practice, I engage in cognitive rehabilitation and cognitive retraining, and it needs to have these baseline measures from neuropsychological evaluations in order to determine what areas need to have a more concentrated effort through these exercises. I call it PT for the brain. And then we reevaluate through additional neuropsychological testing the effects and the benefits of the cognitive retraining programs that have been specifically developed for my patients. With the increase of the baby boomer population going into retirement, or actually being a large part of the retirement population currently, I have received a number of referrals to evaluate the elderly for dementia, including to determine the form of dementia that may be existing in these individuals, to assist with treatment planning and to help keep these adults as independent as possible for as long as possible. Not only do people get referred to me to assess the impact of their pain medications on their cognitive functioning, but there are disease processes as well as other forms of medication that can affect a person's cognition. For example, once when I was consulting at a skilled nursing facility, there was a gentleman there that had been cognitively intact 2 weeks prior to my evaluation of him. And he was in the skilled nursing facility because he appeared somewhat delirious, and it came and went. And he was diagnosed with cellulitis, which is an infection of the skin. And he was on a very strong antibiotic. So I did some research about the antibiotic that he was on, and sure enough, one of the side effects, albeit somewhat rare, was the effect that this particular antibiotic had on cognition. And it specifically said that it could cause a form of delirium. So I suggested to the physiatrist that perhaps if there was another antibiotic that was appropriate, that patient could perhaps be switched to the use of that alternate antibiotic, and his delirium cleared. Additionally, the impact of certain disease processes are such that attention and concentration can be impacted. Kidney infections, urinary tract infections, liver dysfunction, all of those metabolic type of illnesses or disorders can affect a person's concentration, attention, ability to sustain their comprehension of what they're reading, their emotions. It's amazing how the human body needs to be in a state of balance or homeostasis in order for the brain to function optimally. And anything that turns the body into a state of imbalance, if you will, can impact cognition. For another example, thyroid disorders. If someone's thyroid is out of balance, and especially for women, a lot of times women will say, oh, that's just because I'm undergoing the change. And in fact, it's thyroid that's causing some of the memory dysfunction, the word finding difficulties, the fatigue. And I often ask patients to make sure that they, as part of their neuropsychological evaluation, that they also ask their referring physician for a blood panel, in particularly thyroid panel, to make sure that the imbalance that may be occurring there is not affecting their cognition. Many of the referrals I receive from the Rehab Institute of Chicago or Marion Joy are for traumatic brain injuries. People who might have been in a motorcycle accident or a motor vehicle accident, or have fallen from a high place and have injured their brains. Almost always when there's a brain injury, attention, concentration, memory, sleep, appetite, emotions are disturbed, and minimally. And so my job is to look at the impact of the brain injury on these cognitive functions and to assess what other functions may be related that have been impacted by the head injury, and then to develop a program to remediate these injuries. We can't overlook the impact of repetitive sports injuries as well. I receive referrals from some of the local high schools to assess the impact of a sports injury, from a soccer head injury or a football injury, to assess whether there has been a concussion or if there's a post-concussive syndrome that is preventing the student from succeeding as well academically as prior to the head injury that they sustained through the sport or through a repetitive head injury. Many of the soccer players use their heads as part of their sport, and these repetitive head injuries, which is really what they are, accumulate and cause cognitive dysfunction on a permanent basis. And so I evaluate how much of that function has been disturbed. As part of the cognitive rehabilitation of patients, once I have performed the neuropsychological evaluation and engaged in some form of cognitive retraining or cognitive rehabilitation with them, it becomes apparent that upon their return to work, if that is an appropriate placement for them, that I will formulate work-related accommodations that are necessary under the Americans with Disabilities Act for my patients, as well as perhaps my patients can't go back to work and they need to apply for government benefits such as Social Security disability income. I do complete those forms and assist patients with obtaining those needed services. Sometimes I am called to give a deposition on the behalf of my patient when they have ongoing litigation.